I'm Dr. Samuel Proptik, a dental surgeon and specialized in the field of orthodontics and implantology. So, this is about my new and patent applied concept of dental implants. It is a system and method of push type and customized dental implant integrated with the prosthesis. So, that is, this is a dental implant which is attached to the prosthesis, that is the tooth. So, what happens is in a single visit, the implant and the tooth are placed together. So, this is one of its kind across the globe. And when you see the design of this dental implants, it's a smooth walled implants and parallel walled. So, you'll be able to see the slots in between. The threads are placed inside, and the threads or the fins comes out only when it is activated. So when you look at the activated threads or fins, it looks like this. So here you'll be able to have a clearer picture of how the fins are activated, and the fins gets activated only after it is placed inside the bone or the site. So this is how an activated implant will look like. So when you look at a comparative study of an non-activated implant and an activated, this is how it looks. So on the left, it is the implant which is still not activated. On the right, it's the implant that is activated. So the implants are activated only when it's placed inside the bone. So we developed a prototype, and when you look at this side, there is a tooth that is missing. So we would like to show you how this prototype works. So the first drill on an edentulous site, that is where the tooth is not present, we use a 1.4 mm drill which is called as a lance drill. And this model that we have selected is kind of a plastic which made it little hard for us to do the drilling protocol. And once the lance drill is over, we used 2 mm pilot drill, and this drill is used till the depth we want to place. And right now we have around a 14 to 15 mm implant, so we have drilled till 15 mm. So once 2 mm drill is done, we use a slightly bigger drill after that, and we go in subsequent dimensions, that is a width. So next is a 2.3 mm drill. Next is 2.5 mm step drill, so that it was slightly easier for us to engage the outer walls of the model. And we use a 2.8 mm drill, and the diameter which we have right now of the prototype is 4 mm. So here we need to drill till 4 mm diameter. The next is a 3.2 mm drill which we used till the length of 15 mm. The one before the last drill is 3.6 mm drill. And this drill was also used till the full working length of 4 mm. And this is the final drill that we used, the 4 mm drill. The site was just cleaned to wipe out the remaining debris, since it was a plastic model. Normally this step is not done when we do it on the bone. So now the implants are taken in an inactivated state, so the threads or the fins are still inside, so when if you're able to see, the implant just slides inside easily. That is because the fins are not activated. And when you see the head screw which is on top, it fits to the hexagonal driver, and initially the driver is activated, it is rotated clockwise till around 15 Newton centimeter torque, And after post that, we use a torque wrench. The torque wrench is set at 35 Newton centimeter torque. So the threads are activated now. The fins gets activated and it gets attached to the outer bone. So here if you look at, it's a final activation that we're going to do, and the torque wrench breaks at 35 Newton centimeter torque. So now we have achieved the torque, an optimum torque. So the implant as well as the prosthesis is fixed in a single visit. So this is the specialty about this new concept of dental implant. So the patient goes back with the tooth in a single visit, thereby avoiding the number of visits where a patient requires to visit back. So as we have already seen, the implant went inside without any resistance. So even while trying to remove the implant, it wasn't that easy with an instrument. So which means the threads have got activated, the fins have activated, and it has engaged the outer wall of the model. So the same thing will happen when we place inside the bone. The threads will get activated and it will engage the outer bone. So thereby, in a single visit, the implant and the prosthesis are placed.